I'm Dr. Brown.
I'm Brooke.
Nice to meet you. So today I'm going to be evaluating your spine from about the base of your neck to about your belt line. If I need to expose any skin in the area, is that going to be a problem?
Nope, not at all.
Okay. And can I also palpate you for the remainder of the video?
Yes.
Okay. Let me check the table real quick. Okay. What I'm going to do is I'm going to have you sit facing the window for me, please. So I'm going to go on the top of your iliac crest, windshield wiper down to your PSIS. And I'm just going to evaluate the motion in your SI joint, going from P to A, medial to lateral on both sides. And now I'm just going to oscillate your spine. Now I'm going to do your cervicals. Is it okay if I touch your forehead? Okay. Starting at the lower portion, I'm going to be going from superior to inferior. And as I go up, there we go. And as I go up, I'm going to transition from inferior to superior. Okay. Now what I'm going to do is I'm going to evaluate your SI joints. So if I can have you laying face down for me. Is it okay if I open your gown? Okay. I'm going to start off with your right SI. I'm going to start with your iliac crest. Windshield wiper down to your PSIS. I'm going to put my fingers in the joint line between the PSIS and the sacrum. With my other hand, I'm going to contact your ASIS on the same side. And I'm going to pull the ASIS from A to P and lateral to medial. I should feel the ilium move posterior, medial, and inferior in relationship to the sacrum, and I do. So therefore that's a healthy joint. Now I'm going to do, and that was the flexion test. Now I'm going to do extension. So I'm going to go on this side. Same thing. I'm going to start at the iliac crest, windshield wiper down to the PSIS. Put my fingertips in the joint line between the PSIS and the sacrum. And for extension, I'm going to contact the contralateral ASIS and pull A to P and lateral to medial. And I should feel the sacrum move posterior in relationship to the ilium, and I do, so therefore extension test is good for this joint as well. I'm going to close you up. Okay, now I'm going to test your L2, L3 segment, so can I have you seated facing the window again? And I'm going to open your gown. Okay. So I'm going to contact the iliac crest, bisect across to L4. Okay. And then I'm going to palpate superiorly to L3 and L2. I'm going to put my thumb in the joint line of L2 and L3. Can I have you cross your arms for me? I'm going to flex and feel for the segment to open up. I do feel opening of the segment. Now I'm going to test for rotation and lateral bending. So I'm going to put my thumb lateral to the joint, the L2-3 segment, with my contact on L2. I'm going to rotate. I'm testing joint play, feeling for the segments to separate. I do feel separation between the segments, so therefore joint play is present. Now I'm going to test in play, so I'm going to spring lateral to medial. Feeling for springiness. Springiness is present, therefore in play is present. That was left rotation. Now I'm going to test right rotation. I'm going to put my thumb on the opposite lateral side of the segment. I'm going to rotate to the right, feeling for separation of the joints. I do feel separation, therefore joint play is present. Now I'm going to test in play. I'm going to spring lateral to medial on the right. I do feel springiness, therefore in play is present. Now I'm going to test right lateral bending, keeping my contact in the same place. I'm going to bend her laterally, feeling for separation of L2, L3. I do feel separation, therefore joint play is present. Now I'm going to spring lateral to medial, feeling for in play. In play is also present. Now I'm going to do left lateral bending, putting my thumb on the other lateral side of the joint. And I'm going to laterally bend the patient. Testing joint play, feeling for separation. Separation is present. Now I'm going to test in play and spring lateral to medial. I do feel springiness, therefore in play is present. Now I'm going to test the T8, T9 spinal segment with the corresponding ribs. So I'm going to have you put your arms down for me and bring it behind your back. Okay. I'm going to find the inferior. I'm going to find the inferior aspect of the scapula. Go across to T7. Okay, you can relax. I'm going to go down to T8 and put my thumb in the joint line between T8 and T9. I'm going to have you cross your arms for me. I'm going to test flexion. I'm feeling for opening between T8 and T9. I do feel opening. Now I'm going to test rotation and lateral bending. To test rotation and lateral bending, I'm going to put my thumb lateral to the joint. I'm going to rotate her to the left, feeling for separation between T8 and T9. I do feel separation. Now I'm going to test in play. I'm going to spring lateral to medial. Springiness is present, therefore in play is present. Now I'm going to do left rotation. Right rotation, that's what I meant to say. Now I'm going to test right rotation, putting my contact on the opposite lateral side. I'm feeling for separation between the joint. Separation is present. Now I'm going to test in play, springing lateral to medial. I do feel springiness and give in the joint, therefore in play is present. Now I'm going to test lateral bending. I'll laterally bend the patient. Wait, I did that wrong. There we go. I do feel separation between the joints. Now I'm going to test in play. In play is also present. Now I'm going to do left lateral bending. Putting my thumb to the lateral side of the joint on the opposite side. I do feel separation between T8 and T9. Now I'm going to test in play. I'm spring through the joint, lateral to medial. I feel springiness and give, therefore in play is present. Now I'm going to test the corresponding ribs. So I'm going to have you put your arms down for me and put them behind you so I can identify T7 again. So I'm going to go across to T7, down to T8, and I'm going to go up 2 interspinous spaces, out laterally 1 inch to a TVP, and another inch to a rib. For elevation of the rib, I'm going to go on the inferior border of the rib with my contact, and have you cross your arms for me, please. And I'm going to contralaterally rotate and bend, and I'm going to flex the patient. This is testing elevation. in the joint play. Now I'm going to test in play. So I'm going to spring inferior to superior and also slightly P to A. Okay. Elevation was present. I felt springiness and give. Now I'm going to test depression of the rib. So I'm going to extend the patient and contralaterally bend and rotate. Ipsilaterally bend and rotate. Now I'm going to test in play. So I'm going to be springing from superior to inferior and slightly P to A. I do feel give, and I feel the rib depressing, therefore in play is present. Now I'm going to do the opposite rib. Put your hands again for me down and behind. There's T7, T8, up 2 interspinous spaces. Put your arms back. Out laterally 1 inch to a TVP, and another inch to a rib. Okay? I'm going to be on the inferior border of the rib to test elevation and have you cross your arms for me. I'm going to flex, rotate, and bend. I do feel the rib elevating under my contact, therefore joint play is present. Now to test in play, I'm going to spring inferior to superior and slightly P to A. I do feel the rib springing and easily moving, therefore in play is present. Now to test depression, I'm going to go on the superior border of the rib. I'm going to extend and ipsilaterally bend and rotate. Now to test in play, I'm going to spring from superior to inferior. And I do feel give and springiness as I challenge the joint. Therefore, in play is present in depression as well. So that is it. And I'm done.